All right, thank you everyone for joining us today on Anteater Insider Live. I'm Aaron Orlowski, your host from UCI's Office of Strategic Communications and Public Affairs. You're listening to the live show produced by our office for staff and faculty that's meant to help you get more information about the re-engagement of campus operations during this COVID-19 era. There's so much great information that everyone needs to hear and that we're so interested in sharing with you. And that's why we're producing this show every 2 weeks. So today we are focusing on indoor air quality. You know, much as we might all like to spend all our time outside in the beautiful Southern California weather, we do have to get inside at some point to get some work done. And UCI's facilities management team has taken a number of steps to help make sure that that indoor air is safe and healthy for us to breathe. So today we're going to hear from a couple folks. First, we're going to hear from Matt Gudorf, who is the Assistant Director of Facilities Management here at UCI, and he'll talk about some of the actions that their team has taken on indoor air. And then we'll hear from Professor Manabu Shiraiwa, who is an Associate Professor of Chemistry here at UCI, and he's an expert on indoor air quality. So first we'll hear from Matt, and he'll give us some information, and then we'll do a Q&A with him. So be sure to submit your questions through the Q&A feature at that time, and he'll be able to take some questions. And then after that, we will move on to Professor Shiraiwa, who will give a presentation and then also do some Q&A. And the last thing I want to share before we get started today is that we are recording today's show. So if you have to hop off, or if you know some of your colleagues who were unable to make it, that'll be available on YouTube after the fact. So, all right, Matt, we can start with you. And thank you for joining us today on Anteater Insider Live, and take it away.
Yeah, absolutely. Thank you for having me. Obviously, there's a good deal about indoor air quality of concern, and we want to be able to bring what facilities management's working on to our community on campus and explain, you know, the things that we're seeing, that we're taking action on, and that we're evaluating every day. So if you could bring up the slides. So one of the things we'll point out is a lot of times you hear about heating, ventilation, and air conditioning. That's also all the impact of our indoor air quality, and it's usually abbreviated just basically using the title HVAC. The guidance that we're getting is coming from a lot of different organizations. The campus is monitoring these organizations for the information that they're putting out and then taking action based upon that. First and foremost, obviously, the Center for Disease Control and World Health Organization are putting out the majority of the information, with the CDC really leaning heavily on the guidance from ASHRAE, which is the American Society for Refrigeration and Air Conditioning Engineers. UC Irvine's also working diligently with 3Flow Technologies, which is a company we've worked with in the past for indoor air quality on campus. They're experts in the field. And then UC Office of the President working with Taylor Engineering. We're taking all of this information together to really implement the strategies going forward. So just a quick primer on the heating, ventilation, and air conditioning systems on campus and their different types of buildings and some of the strategies that we're taking. I've kind of drawn some quick diagrams here for you. You have green as your supply airflow and red as your exhaust airflow. And so let's talk a little bit about the lab buildings or lab zones first. Those lab zones are 100% outside air, no recirculation at any time. So we bring in that air, we filter it, cool it, pressurize it, send it out into the buildings, and then that air is fully exhausted out the stacks of the building with no reentrainment of any kind. In those situations, we already actually had very high quality filtration media, and we're going to talk about filtration on a slide coming up. And we have a high volume of dilution ventilation as well. So lab air under COVID situations is about as good as we can get. And we would expect that because of the nature of a lab zone, right, where there could be chemicals or something released into the space. We always have had, you know, a very, very safe air in those spaces. Next, we'll look at office and classrooms, a little bit different type of environment. This is where we have a return air system. So we have air that comes in just like a lab zone. It's cooled, it's filtered, it's supplied to the building. It makes its pass through the building into a classroom or an office, and then it's exhausted. And as it's exhausted, some of that air is normally returned to be filtered, cooled, and pressurized, or heated or pressurized again. And some of it is exhausted or relieved to the outside. So in these situations, under the guidance, we have modulated the amount of outside air to the maximum. We want to use as much outside air as possible. This is a difference from when we normally would operate, where we would have a lot of return air on hot days and a lot of outside air on cooler days. Basically taking an energy conservation approach saves a lot of energy, and it really helps reduce the cost of operating the campus. But now, under the COVID conditions, we've gone to this maximum outside air. We've also increased the dilution ventilation and increased the run hours of these systems to help flush the building. So that's the office and classroom. We've taken actions there. And again, on the filtration, we'll talk about that on another slide. For the trailers and temporary buildings that we have on campus, there are just a few of these, but we wanted to point them out. We have supply that comes in, and then most of the air is just constant return. You're a lot of recirculation. There's limited outside ventilation. We have a lot of exfiltration through windows and doors is how a lot of the air that does come in is relieved. And they have the lowest MERV rating on campus. But again, I'll talk about that MERV rating and the filter technology in a moment, because we really want to say that even though it has the lowest, it's not the worst. So next slide. So most of the transmission that we're aware of to date is through droplet-based transmission. These are the droplets that are affected by gravity. They fall out of the air within that 6-foot radius, which is why we have our physical distancing. This is also in droplet-based transmission where we're wearing our masks, and that really associates the fact that we can help reduce the number of droplets that are coming out, but we can also help prevent droplets from coming in. And of course, all of the other things that would take place under the CDC guidance that we're well aware of. The other thing that we've done on campus is obviously we have a greatly reduced occupancy. The reduced occupancy also means that we have increased dilution ventilation because you have less people to share that dilution ventilation with. We've maximized up to where the air balance will allow. And we've also have to look at air velocity. We don't want to carry droplets any further than they would normally travel. And so we don't want areas with really high air velocity that would carry those droplets beyond where we've had the physical distancing in place. And then of course, we're maximizing that outside air delivery without compromising temperature or humidity. There are times where we still have to run some return air, and that really is because we don't want condensation, we don't want mold growth within the building. So we have to keep humidity under control by wringing that moisture out at the air handler level before we supply it to the space. Next slide. And we've taken all of those steps. Heating, ventilation, air conditioning on an aerosol-based transmission. Aerosol-based transmission, we're not sure that it's happening. There's evidence to suggest that it could be possible. Now we're talking about virus particles that can travel great distances. They can travel greater distances simply because of how fine those particles are. We're talking less than 5 microns. And so now we have another challenge. And so the campus is also taking steps on an aerosol-based transmission, even though the evidence says it's unlikely, but it is possible. And so we've increased the filtration media on campus. We're flushing those buildings with clean air before and after use. So we've increased the run hours. And in some cases, we've modified airflow patterns. And of course, we have room pressurization in our laboratories. We've looked at some of the other things that are on the market. The personalized ventilation systems and the UV lighting systems. Really concern there is limited effectiveness, especially even under aerosol conditions. And of course, the great expense when you're trying to cover millions of square feet of space. So if you bring up what we've completed, I think that you'll see that we've taken a lot of steps on aerosol-based transmission. So next slide-ish. Yeah, start there. And we've done everything we can do on the aerosol. But again, aerosol is not what the main concern is among epidemiologists at this point, and the guidance that they're suggesting, it's all based around the droplet-based transmission. So next slide. So filtration, let's talk about filtration for a moment. Again, we're not talking about the in-zone transmission. We're talking about now where you would have a release within a space, and it goes through the return duct or up into the return of the air system, and then it would be filtered, and then of course cooled or heated, and then supplied back to the zone, and then basically moving that through the building. And so ASHRAE came out with some guidance based on the filtration media that would help assist in reducing the spread if it is an aerosol-based transmission. And so where are we at? We have our trailers. They're at the industry standard. So if you go to a grocery store, typical office building, those places, they're at the industry standard MERV 8 filter rating on those units. And unfortunately, the equipment is designed and sized in such a way that that's where we're limited. Now, when we have the small air handlers on campus, these are buildings like Humanities Office Building, multi-purpose academic administration buildings. So smaller buildings on campus, they have air handlers that have been upgraded from a MERV 10 filter to a MERV 13 filter. This is the ASHRAE recommended filter minimum to be installed under the COVID-19 scenario. And then you have all of the large buildings on campus. So this is your Aldrich Hall, Engineering Hall, Bio 3, McGaw, Roland, these kinds of buildings. Any building with the built-up air handlers on campus, these were already at a MERV 15 rating. They remain at a MERV 15 rating. Many of them have just undergone a fresh filter change. And you can see those are actually 2 steps above the ASHRAE recommended. Now, MERV 17 through 20, those are your HEPA filters. You can hear about those on the media. People have talked about, HEPA filtration. Unfortunately, the fan power required to move air through a HEPA filter is greater than what is installed in most buildings. And so it's not possible to even go out and retrofit to a HEPA filter. Even if you did, again, we're now talking about something with a very, very low probability as being a method of spreading COVID-19. Next slide. So in review, we want to talk about the work that we've taken to date. And one of the key things that we should talk about is the maintenance and operation has never ceased on campus. So even in March, when we started this curtailment, our trade staff on campus continued to maintain and operate these buildings. We did not mothball the buildings. The buildings continued their operations, which really goes a long way to making sure that we don't have stagnation, that these buildings are operating correctly, that everything came back when students come back, when faculty and staff come back, and they're running as designed. We have an increased percentage of outside air. Again, trying to bring in as much outside air as possible with as little return air as possible under weather conditions and equipment allowances, and making use of that air to, again, not have the possibility of running a return air system where we would spread COVID-19, even though that is a very, very low probability. Increasing the run hours, really providing 2 extra hours to flush out anything that might be in the building on either side of the day, so before or after a scheduled occupancy. And then, of course, we've increased that filtration. Finally, we'd like to point out, we continually monitor guidance. As we know, things continue to change, and we're out there making changes as those recommendations are released. So facilities management will continue to monitor what's going on throughout all of our different partners and make and implement changes as quickly as possible based on those findings. So with that, I can get into a question and answers on the indoor air quality, heating, ventilation, air conditioning systems on campus.
Great, thank you so much for that presentation, Matt. I think we have a couple questions that already came in here on the Q&A. So we have a question from a participant here asking about some more details related to the droplet-based transmission. Let's see. I think the question here is, so what do you mean by the maximum amount of outside air? What is the actual percentage of air that is able to come in from the outside in some of those circumstances?
Yeah, so in general, we would have a return air percentage and a outside air percentage. And when I say outside air, I mean basically fresh air brought in from a rooftop or wherever the outdoor air intake of the building is. We're going to bring that air in. We're going to filter it through that filter technology, whether it's a MERV 13 or 15 filter, and then supply that to the space. Some of that air that's been supplied would then normally be returned to the building. In these cases, we're going to exhaust as much percentage of that as possible and bring in as much outside air as possible. So basically, it's highly energy inefficient, but at the same time, it increases our level of, I guess I would say, it mitigates the risk, right? It mitigates the risk of spreading COVID-19 through any kind of return air ductwork.
Okay. And another question here, is there any plan at this point to have classrooms or labs upgraded to MERV 13 by the start of classes?
Yes. So all of the classrooms, those buildings will all be upgraded to MERV 13 by the start of classes. In fact, most buildings are already upgraded to MERV 13. We were on this right away. We did have a delay in one delivery, but we will have that by the time classes start.
Great, thank you. And then, one more kind of technical question here. And so by adding outside air, do you end up compromising the ability to dehumidify the air? And just, how does that balance work out?
So how do we balance dehumidification with the amount of outside air?
Yes, thank you.
So basically the way it works is what we start to see is the increase in humidity at humidistat sensors within the building. And so if we end up in a situation, and we just had this a couple of weeks ago when it was very, very humid outside, and we can't basically get to a humidity level that's acceptable, we do have to add additional return air, basically lowering the amount of outside air, because we dry that air every time it goes through the chilled water coil. So every time we push air across the air conditioning coil, just like you would have at your house or anywhere else, we condensate that, just like water condensates on a cold glass, right? Comes out of the air. Well, the rest of the air goes into the building. So the number of times we pass that air, we end up with lower and lower humidity levels. So we're trying to make that balance. And what we found is in most cases, we can actually run a very, very high percentage of outside air, especially for the majority of the day. Only under very unique weather conditions do we have to dial that back, like we had a couple of weeks ago.
Great. Well, and we still have a number of questions here, but we do need to move on. So we will save these questions for some follow-up later, if possible. But for now, we'll move on to Professor Shiraiwa, who will talk about some of the science behind indoor air quality. So, thank you for joining us today on Anteater Insider Live, and I will pull up your slides here.
Okay, thank you. So I'm going to talk about our research on indoor air quality, and I try to give a couple of practical advice for that and the pandemic. So I want to first start with why we care about indoor air quality to start with. So this is a code that the numbers that shows why the indoor air is so important. So I want you to think about what these numbers means. So the first hint is 79 is the average life expectancy in the United States. So people live on average 79 years. And actually the 70 is actually the number of years you would spend indoors. Okay, so out of 79 years, people spend usually 90% of their time in indoor environments, and more so probably under pandemic, right? And we often care about outdoor air pollution, and UCI has legacy of that. Sherry Rowland got Nobel Prize for his work on ozone layer. So we care about outdoor air, but you actually spend only 4 years in outdoors. So in terms of health effects of air quality, then you would actually need to look more into indoor air. So that's why we are caring more about indoor air quality. And out of 79 years, you wear clothes for 77 years, you are naked for 2 years. And that's something that we are interested in, and we are doing some work on that, which I want to introduce to you. And the project we have on this campus is called the Modeling Consortium for Chemistry of Indoor Environments, which is funded by Sloan Foundation. And this is a team of investigators from 8 different institutions from US, Canada, and UK. And I'm humbled to lead this consortium as PI. And we are the team modeling this indoor air chemistry, looking into gas phase chemistry, gas phase reactions, particle reactions, how the indoor air surfaces affect indoor air quality. And we have a number of different modeling tools, including molecular dynamic simulations, done by Dr. Tobias in chemistry department, up to computational fluid dynamics to look into how air distributes in indoor air. And the first thing I want to mention is about the reaction of ozone, which is one of the most prominent indoor air pollutants, with reaction with yourself. So actually, you might have never thought in this way, but actually you are very reactive because your skin contains a compound called scarine, and that compound has 6 double bonds, which can react really fast with ozone. And that's actually one of the defense mechanisms that we have to protect ourselves against ozone. But if ozone reacts with this compound, there are also other compounds that are generated, as you can see in this figure, which is actually respiratory irritants. So actually that we modeled this system and we found that if you have soiled clothing under pandemic, you might do less laundry and you might wear the same clothing every day. But in that case, your clothing is very soiled, and that basically you are becoming really reactive. And when you react, you make pollution clouds around you, okay? And then that you can see this simulation results in this figure. We call this as a Pigpen effect. So Pigpen is a guy that which always have this crowd surrounding him, and then he is now affecting the Snoopy in this cartoon. So if you don't do laundries, wear same clothing every day, if you're exposed to ozone, you are generating these pollution clouds around you. And this is particularly relevant for polluted regions such as Los Angeles, or also in the aircraft cabin, because in aircraft cabin, ozone concentration is really high. So you most likely generate this pollution cloud. So the practical advice would be avoid wearing same clothing every day and do laundry, encourage to do that. And otherwise, because you will pollute yourself, but not only pollute yourself, but also your peers, like family members or your colleagues close to you. Another thing under pandemic people do more is cleaning, right? Because to kill coronavirus, more and more breach cleaning is applied. And but if you do breach cleaning is based on this chloride-based cleaning. So this breach contains OCl minus, which actually react with ammonia. There are lots of ammonia in indoor environments, and the source is yourself, because when you fart, when you burp, or just a metabolism, you constantly emit ammonia actually, and sometimes that's why you smell, right? And then that actually ammonia reacts with breach and generates, for example, chloramines, which is toxic. Okay, so the practical advice would be open window when you do breach cleaning. Because if you open up the window and the high ventilation, then even these compounds is generated, which is potentially toxic, that could be just transported away to outdoors. Okay, then last I want to talk about airborne transmissions. And I actually disagree with the first talk that I believe that the most important transmission pathway of COVID-19 is airborne. And as an aerosol scientist, we knew that when people talk, so I'm talking now, I'm generating lots of particles in my room here, and then which around the particle diameter is around 5 micron, okay? And the virus itself is 100 nanometer. So there are plenty of room for this virus to be within this droplet or aerosols, okay? So if I say droplet, I mean particles larger than maybe 100 micron, that traditionally people assume that the main pathways, but what now we think, and there are mounting evidence that airborne transmission, aerosol transmission, namely that the particles around 5 micrometer, which can travel far more than 6 feet, should be the responsible for this widespread spreading event of COVID-19. So I was a part of this open letter signed by 239 scientists, and there are a few more UCI scientists who signed this letter to WHO, and finally they acknowledge the importance of aerosol transmission of COVID-19. And I just give you one example of this super spreading event that which happened in Guangzhou, China, in one Chinese restaurant. You may know this because this is also popular in media, but one guy was affected, had a COVID case, and there's AC unit in this restaurant, and only people who are within the airflow of this AC unit got affected by this one person, right? This event can be only explained by airborne transmission because in China or in Asian countries, we don't have much culture to hug and shaking hands. So this could be explained only by aerosol transmission. And then there are also many other super spreading events, such as chorus singing in Washington State, and also the recent outbreak in university, which reopened, such as University of North Carolina, for example, that in 1 or 2 weeks, there are so many students get affected. And I don't believe that all students are just hugging and shaking hands around, particularly under situation. So most likely this airborne transmission is responsible. So with this in mind, so what we could do to reduce airborne transmission, so it is very important to have a sufficient ventilation. And I was really happy to hear the talk by Matt that UCI is making a great effort to minimize recirculation, because minimizing recirculation is very important, because if you recirculate air, then the air just stagnates in indoor air, and then you have high chance to get this airborne transmission to happen, right? So it's very important to avoid closed space. So open up the space, have a good ventilation, and avoid crowded places, and avoid cross contact settings. So this is avoid 3 sheets, which was started in Japan. This is important. And if you can, like what UCI is doing as fast talk, that supplement ventilation with air filtration and applying UV lights would be great, because UV lights can kill virus, and also air filtration, you can remove these particles. So minimizing recirculation and the good ventilation would be highly important to minimize and address this airborne transmission. That's all from me.
Great. Thank you so much for that presentation, Professor Shiraiwa. Let's get into some questions here. I'll start with one question about the restaurant incident that you brought up in China. In that type of situation where the folks who were in the path of that air conditioning unit were the ones who got affected, what kind of recommendation would you make in a situation like that to produce or to reduce future infection?
Avoid going to a restaurant now. Because for the most realistic thing that, so if you are in indoor with multiple people, to avoid the risk, everybody should wear the mask and then have good ventilation without recirculation. That's the way. But in restaurant or bars is the worst example. Because, okay, you cannot keep wearing mask when you drink or eat. So obviously you have to, right? And then you talk and you generate these particles. So I would say that better to avoid dining in the restaurant or bars right now.
Okay, great. Well, and if folks have some other questions, please feel free to submit those through the Q&A here. But maybe for a second, we could see if Matt could weigh in on that topic really quickly of the indoor air. Feel free to.
So obviously, I want to point out that we are in no way dismissive of aerosols from a facilities management perspective. As the professor pointed out, we're taking steps specifically to mitigate that. The restaurant in question was making use of a 100% return air unit. So basically, it was just continuously recirculating that aerosol within that space. Facilities management knows that aerosols are a problem. We're saying, hey, we don't know what the risk is there. We know droplets high. We don't know what the risk is here, and we're taking actions to mitigate those risks. And the number one thing is that if you take that restaurant situation, if you would have exhausted all that air, which is now what we're doing in FM, you'd have a much lower transmission rate. And I think that we just wanted to make that clear. That we're not being dismissive of aerosol-based transmission. We're saying that we're not sure what the percentage chance is, and we're taking action based on that.
Yes, I was really happy to hear that you said that you try to maximize outdoor air portion, right?
Thank you for both of those pieces of input there. We have a question that's not related to UCI directly, but could be interesting for Professor Shiraiwa to answer. Why was WHO so reluctant to acknowledge the potential significance of aerosol transmission?
This is a very interesting question because it's puzzling, because actually the SARS-CoV-1, which happened in 2003 in Asia, actually aerosol transmissions was also already found to be a major pathways And why not now for this one? I have no idea. There's some sort of, it's dating back to 1910, 1920s, that there's a one big scientist who said that the droplets should be the one that which you're responsible for this virus transmission. And somehow that's prevailing right still. But I'm really happy that now people realizing it, and then WHO finally acknowledges it. And it's now really the time to act to mitigate that.
Great, thank you for that. One other question that I had in mind here was, you mentioned that UV light could be a good way to disinfect some surfaces. Is that something that can be applied to a whole room, or is that something that's more of a spot treatment that could be applied to a specific area?
Yeah, so it could be applied to within rooms. I know that some airline companies start trying to applying UVs after passengers got off, right? But for building perspective, maybe it's the most efficient. Maybe it's just applying UV lights to the filters that to just kills the viruses. But I'm not a building scientist, so I cannot really give out specific advice on practically.
Okay, well, and we do need to wrap up here, but I wanted to ask one more question from something that really struck me on one of your first couple slides, which is that we spend, on average, I think it was 77 years inside. Was that right?
70 years inside.
So it sounds like the real lesson here might be that we should all just spend a bit more time, outside getting some sun. And would you agree?
Yes, I mean, yes. It's sunny here, so we can go outside. Yes.
All right.
Outside is definitely safer.
That's good to know. Well, thank you so much to both of our guests for joining in on this episode of Anteater Insider Live. We really appreciated getting your perspective and learning more about what Facilities is doing for the indoor air quality, and as well as some of the science behind it. And thank you, of course, to everyone who joined in to listen to the webcast here. And our next episode will be in 2 weeks. So please look for the official announcement on that in your inboxes coming up soon. But until then, stay safe.